So for the past couple of years, there are people in China and here too asking for a hump. Like they would they would man-made a hump for their nose. Yeah, which is like, if you just go to like a bunch of facial plastic surgeons who does not do any Asian, you tell them that you can make your patient happy by making a hump, no one's going to believe you, right? Like everybody's going to be like, you're out of your mind.
There are beauty standards that we think, oh, that hasn't changed since we started our education and training. And for sure, that will not change going forward. But that's so fascinating that some people want a hump now. And you got to wonder, like, if there are going to be other slight variations in what people want in the future, where we're going to have to say, yes, we'll do that for you, or that's not consistent with what I feel like is beautiful for you, so I can't do that for you. So that's, I think, a very interesting dynamic moving forward.
You Are Beautiful, podcast with J. Kim, ND.
Welcome to the You Are Beautiful podcast with J. Kim, MD. I'm your host, Dr. J. Kim, a board-certified facial plastic surgeon, and I'm on a mission to make the world a more beautiful place, starting with you. To become the most beautiful version of yourself, you must embrace these three core truths. The first is that you are beautiful. The second is that you are unique. And the third is that you are worth it. Let's dive into today's episode. Today, I have a wonderful guest joining us on the You Are Beautiful podcast. She comes from sunny Southern California. Her name is Dr. Ivy Ran, and she's a colleague of mine, a facial plastic surgeon, and she has great insight into how she makes her patients more beautiful. Now, as a Asian American herself, Dr. Ran also works with many Asian patients just like I do, and she has some unique perspective to share with us today about how she helps her patients achieve the most beautiful version of themselves. She is the owner of Flow MD Aesthetics and Ram Plastic Surgery. Welcome to the show, Dr. Ran. So nice to have you.
Nice to see you.
All right. So let's just dive right in. How do you make the world a more beautiful place with what you do?
Now, I think my job is pretty self-explanatory, how we actually make the world a beautiful place, because, you know, the job itself is focused on aesthetic and how people look. But I think deeper to that a little bit is we do make people more comfortable with themselves. And I think that that is not just skin deep, you know, how you look. Of course we do that, but making someone feel congruent on the outside and on the inside often provide a very high sense of satisfaction. I think that definitely make the world a more beautiful place.
Yeah, I love where you're coming from. It's that comfortable with how you look on the outside and what you feel on the inside. And it's really that element of confidence that you give your patients, which I think is really great.
As the world becoming more like social media and presenting like we are, you know, putting ourselves out there, whether we want to recognize it or not, you know, the way we look kind of influence how people perceive you. And we just can't overlook that. And then I think that that's why, you know, providing, you know, changing someone's look provides such confidence and such positive impact elsewhere, other than just, you know, how you look in the mirror and stuff. It's just how people perceive you, what you put out to the world. And as the world becoming more connected, more social media, more out there for every single individual, it just becomes more important.
Yeah. I think in terms of social media and what that means for prospective patients, something that I've really seen is an increase in patient knowledge. There's so much information on the internet and on social media regarding the standards of beauty. So how do you feel like your patients bring that in when they meet you?
So for Flow MD Aesthetic Center, which is a clinic that I started in the Bay Area, And now I moved down to LA because of family
Mm-hmm.
reasons. And up there, and I still go up there. I used to go up there 2 days a week, even when I first moved down here. I still go up there, yeah, 1 or 2 days per 1 to 2 weeks to just see old patients and follow up, see any problem patients, or occasionally do a couple of procedures up there.
Wow.
So that area for me is over 90% Asian. And among that 90%, largely they're Chinese heritage or Chinese descent. And this population is very interesting to me, or this population, my patients, very interesting. They're largely very different than my other group of populations patients. They are much more, or maybe that's also San Francisco. I can't tell because it's just, they're all very information driven. So they'll ask you a question like, let's talk about something that's like not a surgery, but they even for surgery, there was a patient the other day asked me for suture blepharoplasty, what type of suture I use. They are very much detail oriented, that they've read a ton on the internet, for the better or for the worse, and then they come and have very strong preconceived notion of what they want to do and what they have heard. And I think that's made able by the large amount of information that's out there on the internet. That's one thing that I see with my patient and, that specific population. They downright will tell you all the details that they want, that they learn, whether it's right or wrong. And then you have to build trust from there to tell them, what you think of what they have read and sort of connect with them that way. But I think generally speaking, for everybody, there's more information out there for sure. And then social media also creates sometimes burden for us, I think. And then that could be burden on our patient as well, in the sense that I feel like this is just expectation is much more, I think, higher now. Like, because, that's on our part too. We want to show our best work. You're never going to show your mediocre work to the world. You're going to put your best work out there. And so patients generally now get the information that this is the work they would expect for every single one of them, right? So I think that the expectation is much, much more intense. Sometimes that's a good thing because it's easier for you to communicate, what you would look for in an outcome. But sometimes it creates a problem too afterwards, because expectation and outcome has to match for that satisfaction to happen. And sometimes that's harder if their expectation is exceedingly high. Yeah,
I agree. And just kind of my initial thoughts on that, the burden of how social media affects us as surgeons and affects our patients is like, there's a standard that we want to our patients to reach, and we want to help them get there. And then not only is it that, but then once the patient goes through a procedure or a surgery, then they look back on the social media and they compare the result to that. Right.
Yeah.
And so that's a very interesting phenomenon that we really haven't had before, but now our patients have to deal with that. And the other thing, and you were mentioning this before we started recording, is that a lot of people, especially in our Asian culture, like, we aspire to some kind of standard of beauty that everybody wants to look a certain way. Can you describe that more?
Obviously, there is even before social media, there is some consensus on what is beautiful, right? Like, for all cultures, they may not be the same, but there is some consensus as to what is. But I think that is, in the recent years, been heightened by social media. Because just imagine that, like, why does a certain filter exist on a social media, right? Because that filter makes a single, like it can only make people look a certain way because that's a filter. It's not, it's not a
Mm,
surgeon doing work, or it's not even a makeup artist doing work, right? So it's just a
right.
filter that puts on people. But that kind of is a social, almost like a social experiment, and make people want that even more because that's the standardized look now. So I feel
Mm,
like instead of having a vague idea of what is pretty or what presumably is pretty, be more accepting of more of that. Now we have a more standardized look that everybody
mm,
thinks that your lip has to be a certain perkiness and certain size, maybe
mm,
for you to be looking pretty. Maybe your jawline has to be a certain snatched, squared, tight
yeah.
to in certain angle of the picture to be pretty. And that
Mm,
is cross culture. But as we were mentioning to one another pre recording, that this is
mm,
there's like the standard Asian good looking woman
yeah.
or man would look like, and then there's the
Mm,
standard like US influencer what they would look like. They don't necessarily look the same, but there's that that conglomerate of features that sort of
mm,
everybody's looking to nowadays. And I think
yeah.
that's something that I think it's a pity because I think that, as we were talking and as your show has been promoting, is that, uniqueness is actually something quite important to
Hmm.
general beauty of the world, So
Yeah.
that I think is a hard thing to combat because it's hard to
Hmm.
combat a cultural shift. But I think,
Mm.
I try to instill some of my value and maybe my bias into my patients sometimes. Yeah.
Yeah, with a lot of Korean patients, they have a certain pop star or idol or actor in mind when they think about how they would want to look like. Do you experience that with some of your patients as well?
Yeah. I mean, I don't know. I think that it's probably also same like, when you're doing your consultation. I don't even dance around the question anymore. I just go ahead and ask them. I was like, is there eyes or is there a nose you like? Can we talk about
Mm,
that? And then can we see what in their feature that we can or cannot achieve? I
mm,
just don't dance around that issue anymore. I'd be lying to myself and try
mm,
if I just trying to avoid that question. So I do
yeah.
just kind of go out and ask them. And I
Mm,
do see that quite frequently. Like people are they do have something even for Caucasian patients they will bring in
mhm,
like people even for my male patients male rhinoplasty patients
yeah.
have stars that I've never heard of influencers they bring in and then you're like okay that works
Yeah.
like
As
it's
long
some
as they don't want, yeah, as long as they don't want like Luke Wilson's nose or Ben Stiller's nose, it's like,
yeah, yeah. I don't know if you've heard of this. This is kind of a just talking about Western and Asian beauty difference.
Mhm,
Kind of just a non sequitur to the question. Um, that I've actually never heard of this before until I've seen so many Asian patients. Do you know that
mhm,
in China, I don't know if it's that way in Korea too, because you know how like it's augmentation rhinoplasty that's more
yes.
common in Asia, and
Mm,
which means that you just make your nose. It's not the right term, but bigger, if you were to
yeah.
just make it simple for people
Yeah.
to understand. But
Mhm,
in Asia, in China at least, there's a really famous actress. She was
mhm.
the actress for Mulan, right? And then
Oh, uh-huh.
she has a pretty Western looking nose. She has a hump, so her nose has a hump.
Mm, yeah.
So for the past couple of years, there are people in China and here too asking for a
Mm.
hump. Like they
Oh,
would
wow.
do, yeah, they would man made a hump for their nose.
Hmm.
Yeah, which is
No
like
kidding.
if you tell like if you just go to like a bunch of facial plastic surgeons who does not do any Asian, you tell them that you can make your patient happy by making a hump, no one's gonna believe you, right? Like everybody's gonna be like,
Right.
you're out of your mind. But that truly is
Absolutely.
like at least in China. I'm not saying because of her, but she is only one of, probably a few actresses that has like a generally speaking more Western nose, more projected, more bridge,
Yeah.
kind of nose, and has also a minor hump. And people just because of that consider that beautiful, and they want that.
Wow.
And then they think that is more natural than if you have a straight nose that is done. Because a lot of times if you do, because over there a lot of it is the implant, right? So it's like very straight,
Right.
very smooth dorsum, and then they think that that's fake looking. So they want
I see.
you to have like a little hump, which was I find it fascinating. Like that kind of stuff I find fascinating.
Yeah, we don't learn that in training.
No.
How to make a hump. We all 99.9% of our Caucasian patients want their hump gone.
Yeah.
And then for our Asian patients who have low nose bridges, they still don't want a hump. They just want a higher
Most of the
bridge
time.
in general.
Yeah,
So,
I would say that. I would say that 90% of my patients don't, but I've had a few in the past few years, maybe one or two that wanted a minor hump, which I was like,
that's so interesting.
I don't know what to do about that. I'm also not doing implants. Obviously I'm doing like, at the maximum I'm doing, at maximum I'm doing like cadaver rib, right? Like I'm not using any of that stuff. But, in Asia, a lot of them is doing basically Gore-Tex, and then they would just carve a slight hump. Yeah. And I was like, I don't know how to. Wow. Yeah. So I find that very interesting.
Yeah, it's very interesting that, there are beauty standards that we, just based on our length of training and our career, that we think have just been there all along, right? And we think, oh, that hasn't changed since we started our education and training. And for sure, that will not change going forward. But that's so fascinating that some people want a hump now. And you got to wonder, like, if there are going to be other slight variations in what people want in the future, where we're going to have to say, yes, we'll do that for you, or we're just going to say, that's not consistent with what I feel like is beautiful for you, so I can't do that for you.
Yeah.
So that's, I think, a very interesting dynamic moving forward.
I have a question for you, since I think you're longer in training. What do you do about that in that situation? When you have you feel like the patient is bringing something, you're like, no, I can't. For example, a very common thing is like if a patient comes in and they want a ski slope nose, right? That's pretty common. And I personally am just kind of like, that is not that much hump reduction is probably not, not going to give you a great functional outcome. And then also, it's just not really a good look in my opinion. And then so that there's that clash of like what you think or you hypothesize eventually the patient will think as beautiful at the time of consultation or at the time that you meet them is not what they think. They wanted something different than what you think. What do you usually, how do you usually resolve that situation? And what do you usually do in that situation?
It's a very interesting question, because our results and how our patients feel about their outcome, it's in many ways subjective, right? It's not like, oh, your nose measures so many millimeters, it's such and such angle, that's what defines a good result. It's really how the patient likes it. The first consideration I have, and I think, and you kind of alluded to it, is that if we know that what they're asking for is in contradiction with the function of our face and neck, right? Like the prime example is where you want such a small nose, like you want such a scoop nose that it's going to plug you right here so that you can't breathe and you talk like this for the rest of your life. Then I say, I can't do that for you, or like, I'm not the person who will be able to do that for you and give you the result that you're going to be happy with long term. And so it's as much as we want to help people, sometimes the best answer is no. And I think along those lines, the second kind of big criterion for me is, are they emotionally in a place where they just don't think about the short term result, but also kind of what we know to be long term, what can
Yeah.
happen after such a surgery, such an operation. And so I think those are two big factors for me. It's hard to say no because our patients, like, they trust you with this really vulnerable request, and they come to you because you're supposed to be good at it, and they researched you from like dozens of plastic surgeons, and they think you're the one, and then you say no. You hate that they're kind of
Yeah.
disappointed in some ways. But yeah, I think that's an ongoing struggle, and every patient's different. I mean, you've seen many, many patients through FlowMD and through your training, and everybody's a little bit different in terms of their personality, their expectations, and this is on top of their physical features, right? Their physical features are unique, but also their person is unique. So I think that's where our artistry comes in, right?
Yeah. Yeah, for
Yeah.
sure.
A lot of people are concerned about how quickly they'll be able to go back to normal life after surgery, after a procedure. And
Yeah.
so, among the patients that you see, kind of how do you coach them through that? And what are some of the feedbacks that you get from your patients as they go through that journey?
It's a very interesting question because you and I are both in facial plastics, and oftentimes that you the recovery time, the people can't just stay at home, for the whole time that they're
Mm,
recovering. So that's a common question that gets asked or felt like you had to answer.
mm,
I try to give people some sort of like a diary from another patient that is something that,
mm.
like, as in, like, daily. This is more common for my eyelid patients, like
Yeah.
the Asian eyelid patients.
Hmm.
I think the Asian eyelid patients oftentimes are more impatient than my rhino patients, because rhino,
Yeah.
despite it being swollen, it's passable. It's almost like
Hmm.
passable. Like,
Yeah.
whereas if the Asian person is in the Asian community and getting a double eyelid surgery,
Hmm.
even at week 2, sometimes is not completely
Yeah.
disguisable, with,
Of
because
course.
it's right in the middle of the face. So I often
Hmm.
tell people is that, this is something that you're unlikely. Like, I straight out of the door
Hmm.
tell them that if it's something that you don't want people to know, it's unlikely to go that way. So if you,
Yeah.
like, want to get a surgery, go to work, and then somehow people don't notice that you had this surgery, this is just not one of those surgeries. I would just tell them straight
Yeah.
up like that. But oftentimes that, people will think that they're the lucky one, right? Like, they want to think that, because they will ask, what's the best, what's the worst, and then you show them the
Mm.
best, you show them the worst. No one ever remembers the worst. They always remember the best and then hope that they're the best. And that's why they
Yeah.
come to you, right? Like, they are like, oh my god, you can be completely fine at 1 week,
Hmm.
and
Hmm.
then I basically keep checking in with them. There's no two
Mm.
ways about it. It's just like
Yeah.
I just keep reassuring them that, most likely these are going to go away, or like it's not going to be
Hmm.
as swollen or something like that for until
Right.
then.
Hmm.
Yeah, it's a tough process, and for such a small procedure, because double eyelid surgery really is a small procedure, but
Yeah.
the recovery is can for some people can be very long, and it
Mm.
can be very, very, very anxiety inducing, because they kept thinking that they're going to
Absolutely.
need revision or something because it's looking
Hmm.
so wide or whatever. And there's
Right.
also the people who this is through my experience, because, the height that you set on these are millimeter can be the difference. And for some
course.
people that you do it, like they get a really nice result at the beginning. And if they have a little bit of laxity, they're not the youngest patient that come in, and it's not their high school, going to college gifts anymore. And then you're doing them and they're like early 30s or late 20s, not really that lax, but a little bit of laxity on the eyelids. And then over time that it just like kind of droops and then makes their like the double eyelid even smaller than, they wanted.
Yeah.
That's also a problem. So I tell them that it's a balance, like you either want now a little bit of time where you're like experiencing the swelling or like unhappy later. So just keep reassuring them. That's how I do it. I don't know if there's a magical better way of making patients feel more comfortable, because oftentimes that this is the first time that I experience something like this. And it's hard and it's something that they get reminded all the time, because every day, they wake up, the mirror, they're right there. So it's like kind of hard to reassure or to feel reassured sometimes.
Yes. Yeah. And along those lines, I've had some patients where like everything you say, like I can think of patients who have been through that and felt that sort of thing. One of the other aspects I think of recovery is that you were mentioning a little bit that, a lot of the patients whom you see come from very Asian communities, like San Francisco, Chinatown, LA, Chinatown, Koreatown, very tight-knit communities. And so not only are you looking at yourself in the mirror and feeling a certain way, but your friends and family also see you and are feeling a certain way. And some of them can try to be nice about it, but like especially older Asian people, they don't care.
Man,
they will tell
older
you.
Asian people are so brutal. I mean, I don't know if other people have seen all those like Asian comedians talking about how like their like mom or grandma would just say like you're fat, like it's in Asian culture. That's like totally okay if you go to, your aunt's house and then you gain a few lbs and then they just come out and then straight up call you fat, and then that's like no, that's normal etiquette. So they'll say things for sure. Yeah.
Yeah. Do you feel like some Asian patients carry that burden or that scar in when they see you and or when they go through their patient journey?
I think at least my Chinese patient is much more cultural. I think it's not so much, when I say that, I meant it's not so familiar. Like it's not, I don't think that it's a trauma, but I think that like society, like Asian society in general is much, much more critical. It's just kind of like, how your Asian parents always feel like you didn't do well if you didn't get A's. And then whereas like, really, if you're doing your best, it's fine. But like in Asia, that's not okay. You should get A's. Like, even though only a portion of people will get A's, every single one of your child should get A's. That's how everybody feels. And that's a societal pressure for Chinese people. There is a social media, which I was pretty active on, and met a lot of my patients through. It's a completely Chinese social media called, the translation is called Little Red Book. I don't know if you've ever heard of it. Probably not, or maybe.
No, I haven't. Yeah.
Because it's completely Chinese and it's not like WeChat or anything like that. So it's not like historically big. I think the user are probably overwhelmingly female. Like that platform is overwhelmingly female, and it's overwhelmingly focused on aesthetic fashion, beauty and that kind of stuff. And I think it's good that it's making people more accepting of the type of work that we do and sort of removing the stigma. But the other part is that it definitely brings up a pressure. Almost feels like, well, I cannot not do Botox. I cannot not get Ridgerin, because everybody else is getting Ridgerin. That Asian mentality of like, I don't want to fall behind. I think I definitely see that a lot. Yeah. Like, I don't want to fall behind. I want to make sure that I do the maximum preventative, even though I'm 25 and I have not a single wrinkle on my face. I want to, do all the right things to the right, like I don't want any angle of my photo show me anything that's bad because, all these technology is available and everybody else doing it. I got to do it. I got to get there, that kind of stuff. So I don't know. Yeah, I don't know about trauma in terms of like other people commenting, but more just like the societal pressure, like of always striving to be, that I think that definitely permeates through just even people and their relationship with aesthetics.
Yeah, I guess maybe trauma was not the right word, but maybe more of our cultural upbringing,
Yeah.
our experiences, and how they impact us and shape us.
Yeah.
The idea of everybody else is doing it, so I better do it. That's a cross-cultural thing, but also a very Asian thing, I think. At least in the US, there are many major elements of our lives where we want to be different. We want to be
Yeah.
individualistic. But in Asian culture, like if you look at Seoul, like all the apartments are the same. Everybody's apartment looks the same.
Yeah.
And so everybody's beauty regimen is the same.
Mm-hmm.
And I think, probably in the Chinese culture, there's something along those lines as well, right?
Yeah, for sure. I mean, we look to Korea. I mean, I just had a patient who comes in who went to Korea for surgery. And I was like, you don't want to get surgery for me? But, I've certainly had, that too.
In terms of Flow MD aesthetics and your plastic surgery practice in California, talk to me about how that kind of started and grew into what it is today, and how Asian patients came to be such an important part of your practice.
Yeah, it was kind of crazy because honestly, I never thought that I was going to serve Chinese population. I would have probably focused a little more, like trying to seek out some stuff during training a little more, had I known
Right.
that this was the path. Because we alluded to there are some differences in practice, and there's certainly different things aesthetically that I would have paid more attention to. But I was doing my fellowship in San Francisco, and I, like many of the fellows, you have fellow clinics. And I was telling you that I was on the Chinese social media, primarily just for education. I really wasn't going on there to like, get patients or anything. I was just like putting out videos, kind of education. Had a little bit more time than I was in residency, was in fellowship. So that's where I initially found some patients. And it's very interesting because San Francisco actually has a high Chinese population, but aren't that many Chinese focused aesthetic provider back when I was doing it, which was 3-4 years ago. Now it's getting more. There is a need that's unfulfilled within the area that more people are going into trying to, sort of dedicate their time to this population. But because they're very unique, they look for, I would say that, they look for very specific things. I happen to be there to offer those specific things when I was a fellow. A lot of the non-invasive treatments. I just happened to be in the clinic and we had all those technologies, and they were looking for, things like radio frequency stuff, like that's really popular in Korea, for example, like Thermage or Althera, those type of therapies that were available to me to use as a doctor then, and who also speak Chinese and understand what they were looking for. And, a lot of the patients are younger, but they wanted those treatments. A lot of the American providers would dismiss their concern because they feel like they're too young to get these treatments, despite it being really popular in Korea for younger patients, right? So they feel like they have nowhere to go to get these type of treatments. That's basically where I started. Traditionally, right, if you're in training, a lot of them would tell you IPLs are not for Asians. IPLs are super common in Asia. It's just a matter of which machine and how you do it, right? So like those were the patients that I got initially. It's like basically because there aren't a lot of providers in that area dedicated to Chinese people or Asian people. And I just started, seeing these people, and, our business is all about friends refer friends, and then they all know Asian people. So eventually it becomes like an Asian or Chinese only practice, or a Chinese predominant practice, which wasn't my intention to begin with, but I happily embraced that part. And I think that I certainly have an edge over, a non-Asian. I'm not saying that they can't do it. I'm just saying that it's easier. The entry, the barrier entry is much lower for me because I speak their language. I understand, I actually grew up in China all the way until I was going to college. So I wasn't born here or anything like that. So I understand, really deeply, like the kind of looks that they were looking for. And that is different because, I lived there, and, people, you grow up, you kind of have the same sort of view. I always joke, I said, when I was growing up, that this may sound bad, but I have a good intention behind it. Movies weren't really, Western movies are just, I'm older, so just going into China at that time. And Jackie Chan was like just making movie then. And the first movie Jackie Chan made, Lucy Liu was in it. And I'm sure, like, who am I, or whatever the movie is called, I don't even remember at this point. I'm sure that Lucy Liu in America, generally speaking, if you ask people, they'll say that she's an attractive woman, right? Like she's an attractive star. Maybe it's not your taste, but generally speaking, I think that would be true. Everybody in China at the time was like, she is so ugly. Could we not find a more attractive Asian person to be in US movie?
Really? Wow.
Yeah, that was the view. And I, unfortunately, did hold the same view back then. And I don't know what has changed after being in America for like over 20 years at this point. I was like, she is a beautiful woman. I don't know at what point my view had changed, but I clearly remembered that feeling of, oh, she's kind of not very good looking. I don't understand why, the Western movie, like, why did Jackie Chan pick her? Like that was the feeling that predominantly most people over in China had. And so did I. So I was like, I can understand, if they were to explain to me that they don't want the high cheekbone and they don't want, the really stuck in, contoured cheeks because that ages you. I can understand where they're coming from. Maybe my view is a little mixed now, but I can understand where they're coming from. I won't fight them on it. I will be like, okay, I kind of see what you're saying, and I understand where your fears are. So it's easier for me to provide care for these patients probably than a Caucasian. There are difficult parts of being Asian too, though, that I think a lot of the Chinese, because, like Chinese product, this may also not be PC, but like Chinese product generally doesn't have a good ring to it. A lot of people are worried that, Chinese people take shortcuts, and they generally actually trust Caucasian or non-Chinese provider a little bit more, knowing that, they're not going to take shortcuts. And with me, even though I speak their language, I understand there's always in the back of their head, I feel that they are worried that I would take shortcuts and I would, sort of not do the entirely appropriate things. So I, there's benefits and also difficulties, but I think that it's still much easier. So that's where I started with FlowMD. I did have two very good nurse practitioner that I also met. I want to say mentor, but we really like grew together. I don't think that
Right.
mentor is the right term because I was such a young
Mm-hmm.
provider. One of them wasn't even a young provider. They were in aesthetic for like 10 years, which just happened
Yeah.
to be. Yeah. So I was very lucky to have them. They were still working, in FlowMD and providing care
Mm-hmm.
and sort of overseeing a lot of the day-to-day stuff. And they can see consults and just sort of like do treatments when I'm not there and still run the
Yeah.
clinic with me being the director and now moving to LA. But yeah.
Wow. In such a short time, that's a quite a journey.
Yeah.
So yeah, I applaud you for sticking through it, and even going up and down the coast.
Yeah.
That's a long trip.
It's harder now, because now I have a son, but
Hmm.
like, still, I'm in a unique position to provide care for these patients.
Hmm.
Despite, there might be some trust problems I have to work through, but I think every doctor has to work through trust problems in some
Yes.
way.
Hmm.
And
Yeah.
that's not unique. It's just maybe you have to have different ways to provide that trust for this population. So,
Hmm.
I never thought that I'd be that doctor, but like, because I always thought that, I practiced sort of pretty standard, the American school, everything. I wasn't going to be that
Hmm.
doctor, but I'm happily taking on
Hmm.
that role and learning at the same time. I go take courses over in China sometimes, and I try to go to
Oh,
Korea once. For one reason or another, that didn't work out, but like eventually, I think I would go to Korea or like Singapore or something
hmm.
for some of the courses as well. But yeah.
In 2018, I was able to go to Korea to Asan Medical Center to
Mm.
watch Dr. Chang perform
Mm-hmm.
Asian rhinoplasty, and that
He's the
just changed my
best.
life.
Yeah, he's the best.
Yeah, back to your story of just starting in that niche and really growing your practice to really help a lot of Asian patients is really a great story. I think the pluses and minuses of being Chinese, being of that culture and heritage, and interacting with people, that's so important in terms of building that trust, building that relationship. That
Yeah.
I mean, I could not do that with a Chinese patient like you can, and obviously, like our Caucasian counterparts, they would have a very tough time doing that as well. So
Mm-hmm.
I think it's great that you're leaning into that to help make your patients more beautiful in Northern California and in Southern California. So hats off to you for that.
Yeah.
Not just in facial plastic surgery, but in other parts of life. And you have obviously, there's a lot of stuff going on. You have a young son, you're traveling a lot. Where else do you find time to enjoy beauty in your life?
Recently it's been hard because my son is 20 months old. So a lot of like outside work time has been dedicated just, spending time with him because it's hard during the week and it's hard, working as a physician and owner and trying to find time. So other time is all spent with my son now, and a lot of
Mm.
son related activities like this weekend going to like friend's son's birthday party, that kind of stuff.
Yeah.
So
Hmm.
it's been quite monotonous a little bit. I liked arts, like,
Hmm.
just I'm not, there was a really great artist in my residency program. So I can't even say that I was a good, artist, but I did enjoy doing, lessons of arts outside of work, that kind of art.
Hmm.
I do
Yeah, yeah.
enjoy doing that kind of stuff too. I
Hmm.
know Dr. Kim plays violin, right? I've
Yeah,
seen
so
your
that's
videos actually. Yeah. Back
thank
when
you.
I was very, very young, I did learn violin for a time, but
Hmm.
I'm no longer, I was terrible. And I was definitely an Asian parent's nightmare in terms of my journey with the instrument. But I do like music quite a bit. I did a long time after I abandoned my violin. I did a lot of singing for a while.
Oh, cool. Very nice.
But hasn't really been doing much for the past few years, for sure. Just been it's been kind of busy, yeah. But that's probably what I like to do, in terms of beautifying the world. Maybe those are some of the stuff that I do. Trying to see if I can get in a little bit more volunteering once kids go into school, like start preschool, maybe just restart some of volunteering stuff with the school and stuff. I hope that would bring a little bit more other activities outside of work too. Yeah.
Great.
Yeah.
Yeah. I think that arts, whether it's visual arts, performing arts, it really ties in a lot to what we do, right? As facial plastic surgeons, is yes, there is a technique to what we do. There's certain moves that we have to make when we perform blepharoplasty, rhinoplasty, facelifts, things like that. At the same time, everybody knows, like all the artists know how to put paint on canvas, but it's that artist touch that you develop. And with your Chinese patients, you're developing that so well. So I really commend you for that.
Thank you. Thank you.
If people want to get in touch with Dr. Ivy Ran, how can they reach you?
They can certainly go on my website and trying to leave us a contact form through the website. They can also DM me at the Instagram. My Instagram handle is dr2.ran. So Dr. 2 Ran is me. So they can reach me there. Those are probably the two main ways to reach me.
Awesome. So for those of you watching on YouTube, for those of you listening on our audio platforms, we're going to leave those links in our description. FlowND's website is asian-aesthetics.com. That's ASIAN-aesthetics.com. And Dr. Ran's Instagram handle, dr2.ran. So with that, I really want to thank you for joining me on the You're Beautiful podcast with Dr. J. Kim. Really love what you're doing and making the world a more beautiful place for your patients. And I wish you all the best of luck in everything that you do.
Thank you.
All right. Thank you for tuning in to today's episode of the You're Beautiful podcast. Thank you to Dr. Ivy Ran for spending time with me discussing how she makes the world a more beautiful place. Until next time, remember these 3 core truths. You are beautiful, you're unique, and you are worth it. Take care, everyone.